2 साल हो गए।
2 साल। कैसे शुरू हुआ था ये?
जब छोटा सा था।
हाँ, अच्छा। इससे कितना छोटा था? इसका आधा था?
इतना सा था।
इतना सा था। इसमें कोई दर्द वगैरह होता है?
अब थोड़ा दुख है।
थोड़ा दुखता है। अच्छा, तो 2 साल में इतना बड़ा हुआ है। कोई चोट वोट लगी थी? नहीं। तो अब जो है इसमें किस वक्त दर्द होता है? किसी हाथ चलाने से या?
हाँ, थोड़ा काम करना।
तो और कोई परेशानी इसमें? कोई पहले इसका कोई इलाज वगैरह कराया?
नहीं।
अच्छा, चेकअप कराया? क्या चेकअप कराया आपने?
कुछ कराए फिर बताया।
अच्छा, तो इसमें बस आपको रोज खुजली वगैरह होती है इसके अंदर? कुछ नहीं, बस ऐसा लगता है कि कोई गांठ है। दर्द तो नहीं होता?
ना, हल्के हल्के कभी
होता है। So when you have a patient with a swelling anywhere in the body, है ना, so you have to ask where is the site, then you have to ask what is the size, then what is the shape, then the onset, when did it start, and over the period of time what is the progression of the disease. It is slow progressing, rapid. This is 2 years, so it's a very slow progressing. Why you want to know why it is slowly progressive or rapidly progressive? Yes, if it's some disease which is malignant, then there is progression rapidly, say about 15 days or 1 month or 2 months, it goes rapidly. But if it is a benign disease, it takes long time. Plus whether it's painful or not, है ना, and whether it's accompanied by fever or tenderness or anything of that sort. So in this case, इसमें छूने से दर्द होता है या ऐसे अपने आप ही और दर्द होता है? छूने से भी होता है। बुखार तो नहीं आया? बुखार नहीं आया। तो कभी ज़्यादा एक्यूट इन्फ्लेमेशन होता है या एब्सेस होता है तब फीवर साथ होता है। अगर एब्सेस नहीं है तो इट विल नॉट बी हैविंग फीवर और सीवियर इन्फ्लेमेशन नहीं। तो in this case there is a size is say half a centimeter from the beginning, now maybe 2 centimeters approximately. So it is a very slow small swelling, very slow growing swelling over the period of 2 years, and on the right shoulder at the top of the right shoulder. And इसके अलावा कोई और swelling कहीं और कोई गांठ है? This is the only swelling in the body, है ना? So it appears to be a very minor pathology, but you have to make a diagnosis. So for diagnosis पहले तो आपको साइट देखना है ना? तो साइट जो है राइट शोल्डर के ऊपर है, प्लस जो इसके इंस्पेक्शन करना है ना? इंस्पेक्शन में आपको यू टेल अस अबाउट इंस्पेक्शन फाइंडिंग्स. व्हाट आर द इंस्पेक्शन फाइंडिंग्स? नहीं, inspection means to see, then palpation to palpate, then you do the percussion and auscultation. These are 4 steps of examination. So it's a very small swelling, so in this only inspection and palpation would suffice. If it's a bigger swelling, then other modes of examination are needed. So for inspection, what did you see? Anybody who can tell us better? You come tell us.
Swelling on the right upper looks
Size बताओ.
size is approximately 2 centimeter into 1 centimeter.
2 centimeter into 1 centimeter. Any color change? Huh?
No color change.
No color change. Any punctum? No punctum. Any skin color change from the adjacent skin?
No color change.
No redness? No increased vascularity, है ना? So on inspection it only appears to be a 2 into 1 centimeter size swelling, which is almost oval in shape, है ना? And it appears to have no punctum over the surface, and there are no signs of inflammation. Then you start palpating. So palpation usually you compare with the opposite side and with 2 fingers and put it here to see for any tenderness and see for local temperature. First, by this you see for local temperature, and for this you see for tenderness. So it's not tender as patient is not having wincing. Then you try to pinch the skin. You are able to pinch the skin. This is known as pinching test. If you are pinching the skin above the swelling, that means it is deep to the skin. So in this case, we are able to pinch the skin, of course, partially on the periphery, and this swelling is mobile. You can see it is mobile, and it is non-tender, and it is appearing to be firm in consistency. And on palpation also, the size is about 1.5 to 2 centimeters, and it is mobile, and it does not have a punctum. So there are only 2 or 3 things which will be considered in the differential diagnosis. One is a lipoma. Of course, it is not as soft as a lipoma, but since it is the most common pathology, you have to make the diagnosis of lipoma as the first diagnosis. Then the second is fibroma, and third is neurofibroma. But if there was a punctum, then it would be more of a sebaceous cyst. So there is no need for any special investigation in such cases. The diagnosis will waver about lipoma and fibroma or neurofibroma. So in these cases, if you want to confirm your diagnosis, what is needed is fine needle aspiration cytology. You put a needle inside, aspirate the fluid, and send it to the pathologist for confirmation. They will see fat cells, and they will label it as a lipoma. If they are neurons or neurological tissues, then they will label it as a neuro. Fibroma means fibrous tissue only. Neurofibroma is a combination of nervous tissue and fibrous tissue. So these are the only 3 differential diagnoses in this case, as there is no punctum. But if the punctum was there, then it will be mainly sebaceous. And the treatment is very simple. You just give an incision like this, eye-shaped, and lift up the swelling and remove the swelling, and then put 2 or 3 switches. So that is the only treatment, and she will be cured. ठीक है बीबी, हो जाएगा, इसका छोटा सा ऑपरेशन है.